How you doing? I'm sure some of you are here for different reasons today. Some of you may be getting ready to have a child, bring one home for the first time. Some of you may already have children. Some of you may have nieces, nephews, cousins, etc. And you're maybe wanting to learn a little bit more about how to help this child or infant in case an emergency arises. The CDC, also known as the Centers for Disease Control, has done a study on the leading causes of death of children 10 ages and younger. The category that came up the highest is unintentional injuries, and under that category is drowning, motor vehicle accidents, suffocations, falls, poisons, things that happen around the house, things that can happen at school, church, playgrounds, pretty much your daily life. So imagine yourself being at home, something happens, and you walk into a room or a bathroom, living room, and your child's laying there, not breathing, no pulse. Are you going to be prepared? Are you going to understand what to do to help this child in this emergency situation? I'm not here to scare you. I'm not here to tell you that you need to put your child in a plastic bubble and isolate them and keep them away from anything that might hurt them. But I am here to help you understand that infant and child CPR is something that is valuable and is very useful to you as a parent or a child caretaker. I've been in emergency services for a little over 12 years now, and I've been on countless calls involving a child, and we get there and a mother or father is holding the child in their arms, trying to hand them off to us, and there's been no emergency care or CPR done on this child. So keep in mind that it takes a minute for 911 to call us, and it takes another minute for us to get on our trucks, get going, and it could take anywhere between 5 to 10 minutes depending on where you live in rural settings to get there. So you're looking at a 12-minute time frame without any type of emergency care done to this child. The thing with parents doing emergency care, though, is understanding the difference between infant, child versus adult CPR. A child and infant's anatomy is built different. We do CPR on them a little bit different than we do adults. I understand a lot of people are well versed and trained in adult CPR through work in schools and churches and things like that. But doing CPR on a child, the same way you would an adult, you can cause more damage than help this child. There's several textbooks out there. One of the big ones we like to use is Emergency Care and Transport of the Sick and Injured. It's written very simple. It covers a full genre from adult all the way to infants, but it does explain in a simple manner, easy for people to understand, the differences in why we do CPR and how we do CPR on children and infants compared to adults. Having this knowledge to conduct proper CPR is a benefit for us, and it's also a benefit for your child. Doing CPR with proper techniques can keep the child. We've seen people not use proper technique and the child is injured, and that ended up being the cause of death was from improper CPR. Some people might ask, what exactly is CPR, cardiopulmonary resuscitation? It's a life-saving, to me it's a life-saving measure that you as a parent can conduct until ALS arrives, advanced life support, which is us, where we can take over and help your child. Knowing infant-child CPR increases the chances of survival significantly. The studies show for every minute CPR is not conducted, the chances of survival rate drops by 10%. Oxygen without permanent brain damage can start to occur within 4 to 6 minutes. So going back to our time calls, your 12 minutes, so you have significant time without blood flow and emergency care of this child, which drops their survival rate and full recovery significantly. I know a lot of people are scared a little bit leery about learning CPR and infant child CPR, for that matter, because of mouth-to-mouth. They might have to do it on a stranger. There's been studies out. Amy Norton of Medline Plus wrote an article on doing hands-only CPR, and the full survival rate between hands-only CPR and regular CPR, there's not a significant difference. There's only about 0.5%. For full recovery on patients with the 15 minutes or less response time, their full recovery is 7.1% with regular hands and mouth-to-mouth CPR. The hands only is 6.4%, so there's only about a 0.5% difference. So if that's something you're scared of, catching communicable diseases, things like that, there's still an option that you can help and do CPR without having to get too involved. Now, when you don't do any CPR with a 15-minute response time, the survival rate is only 3.8%, so it drops pretty good. Over 15, it even goes even lower. So again, learning the CPR, infant child CPR, every minute counts, and you will give your child a better chance of full recovery without any type of damage and get back to a normal life. Today, I hope you've learned something. This knowledge, like I said, can be used anytime, any place. It can be used at home, at your church, in a store, anywhere. And having this knowledge, you're an asset to yourself, to your family, to your community. I mean, imagine if you're out and about and something happens, your neighbor's child, you're in a convenience store and something happens to a child, and you know what to do in that situation, and you're able to conduct CPR and give this child a chance of survival and a full recovery. I suggest that you go out and find a class. You can find, get a hold of American Heart Association is a good one. The Red Cross is also another good one that they usually give classes, and they're usually free. So they'll have schedules and times, and there's several of them, so it shouldn't be a problem finding one. For those of you that want to learn a little bit more, maybe before you go take a class, there's DVDs out there and textbooks. One of the good ones I like that I recommend is by the American Heart Association. It's called Heart Saver CPR. There's also a book called BLS for Healthcare Providers, and that just covers strictly CPR, and it might be a good way to brush up if you're interested. I hope if you go out and get certified, I hope you never have to use it. But again, like I said, if you have this tool and you are faced with this situation, you give this person, this child, this infant, a better chance of survival. You can be the key in their recovery. So again, I'd like to thank everybody for coming out, listening to me, and I hope you enjoyed my speech. Thank you.